We are rapidly moving on. I think I'm probably in trouble for extending things, but hopefully in a positive way, because I think all of these sessions extremely interesting, very exciting, trying to sort of tease out some of the elements. I'm now joined by Alexander Singh. He is the head of analytics at knownwell. He's going to be talking to us about AI advancements in metabolic care. Alexander, over to you.
Thanks so much. My name is Alexander, and I'm the head of analytics at knownwell, where I lead generative AI and data integrations. Prior to that, I was CEO and co-founder at Alfie Health, where we actually built the first generative AI clinical decision support platform for metabolic health. I'm really excited to be speaking to you all today about advancements in generative AI as it pertains to metabolic health, in particular, how advanced monitoring through wearables can actually improve long term patient outcomes. Currently, over 40% of Americans struggle with obesity, and this matters because obesity has a significant correlation with a wide array of chronic conditions. For examples, patients with obesity are 80% more likely to develop type 2 diabetes, 75% more likely to develop hypertension, and 49% more likely to develop AFib, among a wide array of other conditions like cancer and depression. Prevalence is only on the rise, and since the early 80s, obesity rates have been increasing exponentially. By 2030, obesity rates in the US are expected to surpass 50%, with 1 in 4 Americans struggling with severe obesity. Globally, obesity has also been on the rise, with 1 in 8 individuals struggling with the condition, more than doubling since the 1990s. New GLP-1 medications like Ozempic and Wegovy have been all over global media, but despite increasing usage, obesity rates are still continuing to climb. According to a recent KFF poll, 12% of Americans have taken a GLP-1 medication. So, what's the issue here? Why haven't obesity rates started to decrease? So, first of all, these medications are not 100% effective. They're not the silver bullet that the media once led users to believe. According to real world data from patients, 1 in 3 patients who are prescribed Ozempic or semaglutide are non responders to the medication, which means that they achieve less than 5% weight loss. 1 in 5 patients who are prescribed tirzepatide or Mounjaro or Zepbound are also non-responders. So herein lies an opportunity to identify which patients may or may not respond to medications. GLP-1s also have varying symptom profiles that are really hard to predict, ranging from more common symptoms like nausea and diarrhea to rarer symptoms like hypoglycemia. Again, being able to predict these ahead of time would allow clinicians to achieve better outcomes and adherence, because these two issues in combination with the high costs that we see, especially in the US, lead to anywhere from only 19 to 47% adherence at 1 year, which is pretty bad. And at 2 years, this number is down to 17%. On top of this, clinical models struggle due to a lack of specialist providers, and traditional weight management methods like health coaching programs have struggled with efficacy for decades. For example, Rally Health, which is a health coaching program, demonstrated 3% weight loss at 1 year, which is not enough to lead to significant long-term health improvements. With recent advancements in AI, particularly the efficacy of large language models, or LLMs, we are now able to improve outcomes through clinical decision support, which is actually how we use generative AI at knownwell. We can also use it for patient monitoring and ad hoc advice, as well as risk triaging and disease prediction. The advancements help address the shortcomings that we just discussed with the current standards of care. One of the biggest data points has been the shift in efficacy with out-of-the-box models that are now performing on par or even better than clinicians in diagnosing conditions. Go 2024 demonstrated that GPT-4 alone was better at diagnosing